All right, so today we're going to go a little bit more specific into lifestyle medicine and specifically talk about exercise is medicine. Now, is there anyone here that does not know that exercise is good for you? Everyone here knows that exercise is good for you. So then what are we going to talk about today? Well, the point is this. We know that exercise is good for you. If you talk to a young person, exercise is about having fun, right? I want to play basketball to have fun. If you talk to some ladies, exercise is about looking good, right? But today I want to kind of instill in us the concept that exercise is medicine. So this takes the concept of exercise or the thing about exercise to the next level. Yes? So I want to talk about why exercise is actually, it's not just fun. It's not just about having like a nice body or these other things. Exercise is also medicine. We're going to take it up a notch, yes, to the next level. Exercise is actually medicine. So that's kind of what I want to talk about today. Actually, before that, I want to make a disclaimer. First of all, this presentation is for educational purposes only. So I think everyone understands that. And also, I have no conflicts of interest to disclose to you. All right. So remember, I did a similar picture last time. And if you look at these three images, pretend that you had a chronic heart disease. And you went to 3 doctors. And one doctor says, I think you should go through bypass surgery. The other doctor talks to you about some medications that they want to give you. Then the other doctor comes to you and says, I want you to go walking or running 3 times a week for 30 minutes. Most people would consider that only 2 of the doctors actually gave them medicine. Is this true? The first 2 doctors, okay? The one that's going to do bypass surgery and the one that's explaining how to use the med. Most people would say that after meeting the 3rd doctor that they actually got medicine. No one would really think that. But there's evidence that's coming out now, compelling evidence to suggest that even the 3rd option is considered medicine. Okay, and the concept is now called exercise is medicine. All right, and this is what I want to talk to you about today, so that the next time you go for a run, the next time you go for a walk, the next time you're playing around with your grandkids and you're kind of like out of breath because your grandkids are running around, the next time you do these types of activities, I want you to think to yourself, I'm not just doing health, but I'm actually doing medicine. I'm applying medicine to my own body. Make sense? This is what I want to talk about today. So, in terms of medicine, so just in medicine in general, and in health in general, the way that sickness works is basically this very simple schematic. There's a cause. Remember last time we talked about treating the cause, yes? There's a cause which causes low-grade inflammation, then which eventually leads to chronic disease. Does everyone remember this? There's a cause. It causes some type of pathological, physiological change in the body that's not good. We would consider this low-grade chronic inflammation, which then eventually leads to chronic disease. Medicine, it has to do 3 things in your body. First, it must prevent disease. Make sense? It has to prevent disease. Medicine should be preventative. Next, medicine should treat. It should change your physiology to treat the disease. And the third thing, hopefully, if you have those 2 things figured out, hopefully medicine will then reverse or change the course of a disease. If we can show from the science that exercise accomplishes these 3 things, then we could legitimately consider exercise as medicine. Is this true? Okay, so this is what I want to prove to you today. That exercise prevents disease, or it contributes to prevention of disease. Exercise also has anti-inflammatory effects on your body. And then exercise as a component of a healthy lifestyle helps change the course of chronic diseases, including things like diabetes, heart disease, and stuff like that. All right? So let's talk about first the cause. Exercise addresses the root causes of disease. You might remember last time I talked about the faucet and the running water. And when we talked about how it's useless to mop the floor when you leave the faucet running. You remember this? How many of you remember this? Right? Yes, remember we said that the water on the floor is like the symptoms, the headache, the cough, the high blood sugar. These are all just the symptoms, the high blood pressure. But what was the cause of most of our diseases? Anyone here remember? The eating, the lifestyle, right? Poor lifestyle is the cause, okay? Exercise is a huge component of one of the physical inactivity is a major cause or contributor to many of our chronic diseases, all right? So for instance, there's a study here. These researchers, they found that those who are not active have a 20% increased risk of type 2 diabetes. However, when those people become active, their risk of even getting type 2 diabetes decreases by 17%. Is it making sense? So the blue bar means higher risk. The one that's going lower, downward, that's lower risk. So those who are not active, you increase your chances of getting diabetes by 20%. When you become active, you decrease that chance. Okay? Colon cancer, look at this. Inactive people has a 32% increased risk of colon cancer, whereas those who become active, they actually decrease their risk by 24%. Breast cancer, so breast cancer is huge, right? If you're not active, you increase your risk by 33%. And heart disease, those who are active has a 14% decreased risk. In fact, these researchers, they say that up to 10% of all of our chronic diseases is a result of physical inactivity. Now, some of you might be saying, well, 10%, that doesn't seem like too much, right? 10% doesn't seem like too much. But, if I said such and such causes 10% of our scrapes, scrapes, like you fall and you get a scrape, how many would say that's not that big of a deal? Would you agree that's not that big of a deal, right? You get a scrape, you put a Band-Aid on, right? It's not too big of a deal. However, in this case, what are we talking about? We're talking about type 2 diabetes. We're talking about cancer. We're talking about heart disease, right? And we're saying that physical activity just itself, this is not even including diet, not even including sleep or the other risk factors, just physical inactivity as a single, lone, independent risk factor itself contributes to 10% of our chronic diseases. Does that change the picture a little bit? Yes? I remember last week we had a patient at the clinic, and he was from Korea. He talked about how some of his family members, they had type 2 diabetes. And I believe it was his uncle or his, I believe it was his uncle who had type 2 diabetes and eventually became blind because of type 2 diabetes. And some of you might know that blindness can result from type 2 diabetes because the blood vessels in the eyes become, the sugar causes inflammation and stuff like that. So we're talking about very serious things, and we're saying that physical inactivity by itself as a lone risk factor contributes to 10% of all these things. If you add in diet, that number is going to skyrocket a lot. This quotation here, physical inactivity appears to have an impact comparable to smoking or obesity. Okay, now, some of you might think, well, this seems like a very radical statement, but these researchers, Dr. Ayman Lee is from Harvard University, and one of the writers for this paper was also the head editor for the U.S. Surgeon General's report on physical activity. So these are some serious people who came up with this report. And they're saying that the impact of physical inactivity, so not exercising, is comparable to smoking and obesity. He didn't say that it's the same, but it is comparable. Make sense? Okay? And so I want to ask you a question. If your son, daughter, husband or wife or whoever in your family was a smoker, was a current smoker, how many of you would be very concerned? Yes, you would be, right? Well, here we'll hear these researchers saying, based on the scientific data, that the effects of not being active is comparable to that of even smoking. You see, when you smoke, the big thing is what? Lung cancer, right? But and the effects seem a little bit more kind of obvious. But things that physical inactivity and poor diet, they also cause chronic diseases similar to lung cancer. In fact, the leading killer is not lung cancer. The leading killers in our society are heart disease. Is heart disease, okay? And so, and physical inactivity and diet contributes to this disease. And so, through public health campaigns and stuff like that, we made smoking seen in a very negative light. Is this true? Before they thought that it was cool. Even doctors way back, they prescribed smoking and things like that. right? But now, because of public health campaigns, educating the public and science, we realized smoking is not good, and so we're really slowly weeding that out. Well, I think we've come to a time we have to start seeing physical inactivity as a kind of a plague on our society, that we have to start educating our people, and through public health promotion, we have to start weeding that out of our society as well. How many of you would agree? Yes, okay. So this is to say that physical inactivity, not being active, is a very serious thing. It contributes to a lot of our chronic diseases, all right? All right, so, and we could have done a lot more. I could have shown you a lot more data to suggest that physical activity is one of the causes of our chronic diseases today, all right? Now, let's talk about the next thing that medicine does, which is to treat. After you get the sickness, can medicine help you with that sickness? Okay, that's the next question, all right? And so they did a study. They found that, and actually to backtrack, specifically, can exercise deal with the low-grade chronic inflammation that's happening within our body? Because chronic subclinical low-grade inflammation is the underlying pathophysiology of almost all of our chronic diseases. So if exercise can help bring down inflammation, then we could presume the exercise will help in helping to treat these chronic diseases. All right. So they did a study, and they looked at people, and they found that those who exercise 22 times per month, compared to those who exercise less than 3 times per month, they had a 37% reduction in high C-reactive protein. Now, how many of you have heard of C-reactive protein before? Yeah, you might have seen it on your lab blood test. The doctors usually requisition for it as a standard blood test. C-reactive protein is a basic marker of inflammation in your body that doctors use. So they looked at people that are exercising 22 times per month compared to those who are exercising 0 to 3 times per month. Okay, and they say, okay, let's look at the C-reactive protein and let's see who is higher or who is lower. And they found that those who exercised a lot, so 22 times per month, had a 37% reduction in the risk of high C-reactive protein. All right? And not only that, not just those who are exercising more, but those who are more fit, so who are more physically fit, they found that those people are also less inflamed in their bodies than those who are not fit. Is this making sense to everyone? Yes? All right. So then how does exercise help to bring down inflammation in our body? Okay, what's happening? What does exercise do to our bodies that's toning down inflammation? Well, first thing, exercise helps with decreasing fat. Now, it's very important for people to realize this thing. When you have excess fat, when we carry excess fat, fat is not just a metabolically dormant cell. It doesn't just sit there and it doesn't just do nothing. That's not the case. Excess fat is actually very metabolically active. Fat cells are very metabolically active, and unfortunately, fat cells are very pro-inflammatory, which means they promote inflammation. So when we carry excess fat in our bodies, we're actually increasing the level of inflammation within our bodies just by carrying excess fat, right? And this is why central obesity and excess fat contributes to type 2 diabetes. It contributes to heart disease and these other conditions because fat cells themselves are metabolically active, and unfortunately, they promote inflammation. Well, exercise is very beneficial because exercise actually decreases the fat within our body, which then will help decrease inflammation. But not only that, even apart from the fat, exercise, when you contract your muscles, the contraction of your muscles themselves release anti-inflammatory cytokines, which then decreases inflammation. Is everyone tracking here? Right? So not only does exercise reduce fat, which is good, but just the contraction of your muscles during exercise releases hormones and cytokines in your body that helps then to regulate and downgrade the amount of inflammation in your body. All right? And this is very fascinating. they found that, you know that in your gut, your intestines, you know you have bacteria, yes? You have bacteria. In fact, you have trillions of bacteria. In fact, you have more bacteria in your gut than all your cells combined. Did you know this? Okay? You have more bacteria in your gut than all your cells combined, and the genetic makeup of your bacteria is actually more than all the genes in your own body. So these dudes are really important in here, okay? What they found was that people that exercise and people that are fitter actually have greater diversity of bacteria in your gut, which then they're realizing it actually helps to reduce inflammation. Very interesting, right? They did studies on rugby players, and they found that rugby players compared to not active people, they had more diversity in your gut, and we know that diversity in your gut promotes, helps to regulate your immune system to bring down the inflammation, which is very fascinating. This is very cutting edge science that's coming out. They don't understand exactly what is going on, but they know that these connections are there. So not just the fat or the contracting muscles, but exercise is actually doing something within your gut microbiome, which is helping to reduce inflammation, which is very, very fascinating, at least to me, and I hope it is to you. Exercise has anti-inflammatory effects, and therefore in the long term, regular physical activity can protect against the development of chronic diseases. So says these researchers here. All right, now besides inflammation, how about other things, other beneficial things that exercise does on our body? Let's look at type 2 diabetes. Type 2 diabetes is huge right now. Can exercise help us with type 2 diabetes besides just the inflammation? Okay, and it does. And I want to show you something here. You have to follow along carefully here. I'm going to show you how this all works. So you got insulin, the red thing there. You got glucose, which is sugar, right? You got the cell membrane, and you got the insulin receptor, then something called GLUT4. You see the GLUT4? That is the receptor that is needed, or the channel that is needed for sugar to get into your cells, all right? Normally, this is what has to happen. Insulin needs to bind to its receptor. So there's a little bit of physiology lesson here. When the insulin binds to its receptor, the GLUT4 goes to the cell membrane, and then glucose comes in. Everyone tracking? So I'm gonna review that. Insulin binds to the receptor. The GLUT4 receptor goes up to the cell membrane, then glucose goes in. I want to ask you something. In a person that has diabetes, is this working properly? No. In diabetes, they have something called insulin resistance. You might have heard of insulin resistance, which means that the receptors, the insulin receptor and the insulin, it just, something's not working there. There's resistance, right? So this is not working properly. So then this is why diabetes is such a big concern, because you can give more insulin all you want, but the insulin receptors are not working properly. So this is a little bit of a concern. Well, exercise is amazing, because look what it does. Just by contracting your muscles, independent of insulin, you bring GLUT4 to the membrane, which allows glucose to come in. Yes? So this is independent of insulin. You don't even need the insulin, at least as far as exercise is concerned. The contraction of the muscles themselves promotes the receptors to go up into the membrane, which allows glucose to come in. This is why exercise is an essential, indispensable part of every diabetes management program, all right? Not only that, exercise promotes angiogenesis, and I was very excited to put this word in here because I want to teach you a new word, all right? So let's say it all together, angiogenesis. Angiogenesis, as you guys are all believers, what does genesis mean? Or like creation, right? The creation, right? Angio means like blood vessels. So this means the creation of new blood vessels. When you exercise, you release hormones and factors like VEGF, which promotes the creation of new blood vessels. This is very interesting. Yeah. So you've heard the saying, exercise brings blood to your brain, right? You have to bring blood flow to your brain, so you exercise. Well, did you know that even by exercise, you don't just bring blood to your brain, you're actually creating more blood vessels in your brain as well. Okay, so exercise is really, really important, and this is one of the reasons why exercise actually helps with things like heart disease. When you have a blockage in one vessel, if you exercise, it could create other vessels, which then allows it to bypass that blockage which is very, very beneficial, right? Did you know that exercise actually helps sprout more neural connections within your brain through a hormone called BDNF, brain-derived neurotrophic factor? So it's very interesting. It's like Miracle Grow in your brain. So Miracle Grow is something that you spray on your lawn, right? And then hopefully the grass will grow, right? So scientists, they consider BDNF or exercise as Miracle Grow for your brain. Okay, you are literally promoting the sprouting of more neural connections in your brain. And why is this important? Is because when you have more neural connections, it helps with your memory and your cognitive functioning. Why is that important? Sorry? You think, right? But in terms of like diseases. Because, yes, exactly. A huge health concern these days are things like dementia and Alzheimer's and things like that. And this is why exercise is extremely important as a preventative, but also as a treatment for Alzheimer's. It helps with symptoms of Alzheimer's. All right? So I believe that exercise, it lowers inflammation and also has other effects. It promotes the growth of new blood vessels. It promotes new neural connections and things like that. I believe exercise has treatment potential within the body. In fact, I forgot to bring my textbook, but there's a textbook on exercise therapy, and you can see the list of diseases there. For so many of our chronic diseases, including even heart attack, cancer, stroke, epilepsy, you could keep on listing the diseases. Exercise is an integral component of treating those diseases. All right? So I think we've shown that the science demonstrates that exercise prevents chronic diseases, exercise treats chronic diseases, and I want to end off on the concept of, does exercise as a part of a healthy lifestyle, does it actually help change the direction of diseases? Now, this is really important. Can exercise change the direction of our chronic diseases? And I believe the answer is yes. They did a study on depression. Mental health is huge these days, yes? So they did a study on depression, and they found that those who are meeting the physical activity guidelines, and I'll talk to you later about what the physical activity guidelines are, that those who are meeting those guidelines actually had a 42% remission. The word remission means changing direction in their depression. These are people who had major depressive disorder, the official diagnosis for depression. They actually were able to change the course of their depression by meeting the physical activity guidelines. They did another study where they found that by simply walking, that you're preventing the shrinkage in certain parts of the brain. Now, as you get older, certain parts of your brain actually starts to shrink. Did you know this? Okay, it actually starts. This is why people get things like Alzheimer's and kind of like lose their memory and things like that, because parts of the brain, like the hippocampus, which is very important for memory, these parts start to shrink. Well, what they did was they did a study, and they put people on a walking program 3 times per week, 40 minutes per session. Does it sound like too much? Not too much, right? 3 times per week, 40 minutes per session. And it was kind of a vigorous walk. What they found, and they did this in 120 older adults, and what they found was that not only did it halt, and they did this for a total of 1 year, okay? 1 year of walking, 3 days a week, 40 minutes. What they found was that not only did it halt the shrinking in the brain, the brain actually started to gain mass. So they actually started to reverse the shrinking and change its course. Isn't that amazing? So here, there's a quotation from that paper. It says, exercise training increases hippocampal volume by 2%, effectively reversing age-related loss in volume by 1 to 2 years. A 2% increase in hippocampal volume is equivalent to adding between 1 and 2 years worth of volume to the hippocampus for this age group. 1 year of walking adds 2 years worth of hippocampal volume. How many think that's a good use of 1 year? I would say the answer is yes. Okay, and there's not running marathons. There's not like doing the Tough Mudder. There's just walking. Okay, and you're changing the course of that degeneration. So I think this is really, really amazing. I think part of that is part of what we talked about, the growth of the neurons and things like that. And of course, I referred to this study last time, but they put people, they want to see, you know how your heart, your arteries can get clogged with cholesterol and things like that, right? They want to see, okay, can exercise and as a part of a healthy lifestyle, can actually open up those arteries? And they found that the answer is yes. They told people to go on a low-fat vegetarian diet, do aerobic physical activity, stop smoking, and do some stress management. And what they found was that those who were just who were not exercising, who were not on the healthy lifestyle, they actually continued to clog up the arteries. So the arteries kept on getting narrower and narrower, whereas those who were on the healthy lifestyle program, they actually started to open up their arteries. Isn't that amazing? Right. So they were, without intervention of like surgery and stuff like that, they're actually opening up these arteries naturally by just following a healthy lifestyle. This is tremendously amazing. Okay, now I want to compare exercise to actually medicines, right? To close off here, does exercise, when you compare it to like surgeries and pills, is there any comparison, right? So let's take a look. First, remember that study about depression? The remission was 42% in people who were exercising compared to those who are not. Did you know that antidepressants, the remission rate with antidepressant is also about 42%, which means that the effect of exercise was similar and comparable to antidepressant drugs. Okay, this is really, really, I want to emphasize this because when people have depression, they're often put on medications, yes, with all the horrible side effects and all that stuff, and they say you have to take this for life. Rarely are they told that exercise has a similar effect as these medications. But instead of mentioning the exercise and not to even mention the diet, but they don't even mention the exercise, they just say, go on these medications, you have to take the medications for life, you're going to go through these side effects and so forth. Exercise has a similar effect as the drug, as well. The side effects are only positive side effects. Yes, the only negative thing is that you sweat a little bit. Okay, that's the only negative side effect of exercise. Everything else is beneficial. All right. So next time you know somebody, you have a loved one that might be going through low mood, or maybe that have depression, or maybe yourself, you're going through a hard time. Think about this. Think about, can aerobic exercise, can it help me? And I believe that the answer is yes. In fact, you know Hillary Clinton, right? She says that after she lost in the elections to Donald Trump, that she obviously went through a very low time. And she said that what actually helped her was actually walking through the woods, spending a lot of time just walking in the woods. And that actually helped her with her mood and things like that, which makes sense if you look at the science. Walking and exercise helps you with your mood. All right, how about metformin? How many of you have heard of metformin? Can exercise as part of a healthy lifestyle, can it even compare to metformin? The answer is yes. They told people to go on a low-fat diet, 150 minutes of physical activity per week, and they said achieve 7% weight loss. And what they found was that the lifestyle group had better results compared to those who were on standard metformin treatment. In fact, the people on the lifestyle program, they reduced their chances of diabetes by 58% compared to placebo. The metformin group had a 31% reduction in risk. Okay. Now I just want to point out, they studied people who were close to getting diabetes, so they didn't have diabetes. And so you might be saying, well, they don't use metformin to actually prevent diabetes, which is true. If you're close to getting diabetes, they won't give you metformin. But the point of this study is to show you, how powerful a lifestyle intervention is. Okay? So yes, it's true that metformin is not used to prevent diabetes generally. However, it tells you when you compare lifestyle with the diabetes drug, how powerful the lifestyle intervention actually is. It did better than the drug. And this is really important because lots of people, most of us, when we think of what's the most powerful thing you can do for your body, they'll say the most powerful thing is to take a drug because drugs are powerful. Yes, which is true. Drugs are powerful. They have powerful effects. But the point is that exercise and a healthy lifestyle also has powerful effects on your body as well. Yes? Okay. How about surgeries? Can exercise outcompete surgeries? Okay, this is really interesting. You would think that surgery is probably the most powerful thing you could do upon your body, right? You're actually going in and fixing the problem. Well, they did a study here, and they told people to cycle, to do stationary biking for 12 months, and they compared it to those people who got a stent, like the balloon where they open up your arteries surgically, and they looked at it over time. Okay, what happens? And what they found was that the group that was actually doing the cycling actually had better results than those who underwent the surgery. Okay, listen to this. Event-free survival was 70% in the surgery group, 88% in the exercise group. As in, the exercise group had a better chance of surviving without any heart events, like no heart attack and things like that. Okay, they did better than those who had surgery. The exercise group had 20% increase in their maximal exercise capacity, whereas those who did not, they just went surgery, obviously did not improve their physical fitness. The exercise group had a 32% of the people in the exercise group had disease progression, but the surgery group had a 47% of patients continue to progress in their disease. So what this tells you is that exercise in some cases can actually have more effective results than even surgery. And another thing, the exercise training cost $37,000, whereas the surgery group, over time, they cost about 2 times as much. So pretty much, exercise doesn't cost that much as compared to the surgery group. So this is really important because when we think about what's the most powerful thing on your body, we often think it's the medical procedures and it's the drugs. But there's evidence to suggest that a healthy lifestyle can also have a very powerful effect on your body. And so I want to say it's not exercise or a pill. I would say exercise is like a pill, except it has no negative side effects. If we had a pill that conferred all the confirmed health benefits of exercise, would we not do everything humanly possible to see to it that everyone had access to this wonder drug? Would it not be the most prescribed pill in the history of mankind? I think we all know the answer to these questions. This is by a medical doctor. See, if we had a pill that had all the benefits of exercise, it would be the most prescribed drug in the history of mankind. We would make sure that every single person had that pill. But pretty much all of us can go and get that pill. When you want to get medicine, you need to get a prescription. Exercise, you do not need to get a prescription for exercise. You can just go out and do it yourself. You don't need to go to the drugstore. You can do exercise, and it is that pill. So I believe that the science shows that exercise prevents disease, it treats disease, and also contributes to reversing disease. All right, so now I'll just close off very quickly here to talk about some of the practical things. So how much exercise do we need? The Canadian Physical Activity Guidelines says that we need at least 150 minutes of moderate to vigorous physical activity, aerobic physical activity, every single week. 150 minutes per week rounds out to about 21 minutes per day. Okay. They also recommend doing muscle strengthening exercises, so it's like lifting weights and stuff like that for your muscles at least 2 times per week. And more physical activity is better. How intense? So how intense does the activity need to be? Moderate intensity is the activity that makes you sweat a little and breathe a little harder. Vigorous is something that makes you sweat and something that makes you out of breath at the end. All right, so power walking, is that moderate or is that vigorous? Power walking? It's moderate, yeah, I think it's moderate, okay? Jogging would be vigorous, okay? Biking is considered moderate, all right? So this is kind of how you gauge it, okay? If you're like sweating a little bit, and then that's considered moderate. If you're like at the end, if you're like, or I'm really, really out of breath, then that's considered vigorous. We need to get 150 minutes of that type of exercise every single week. A very basic kind of prescription. And the more they say, the more is better. Okay. And I want to point out here, when we think of like aerobic exercise, we often think of like doing marathons. I want to run my first marathon and things like that. I want to say that you don't need to do that kind of stuff. Just simple getting out there, just walking 20 minutes, 30 minutes a day. That kind of stuff is what we want to promote here. And also encourage strength training exercises as well. And to end off, I want to say that it's never too late. This gentleman is Charles Ugster. He started kind of lifting weight stuff when he was like 60 something years old. He holds several gold medals and several records in like running, sprinting, and rowing and things like that. He has a very interesting TED Talk where he talks about his experience exercising. So he started later, and it's never too late. I want to point that out. Also, this gentleman here, he's age 63. You can see he's really, really ripped and jacked up at that age. Even at the age of 79, you could see there, he's still quite muscular. So it's not to say that we should all become like this. That's not what I'm saying at all. That's not the point. Just the point is that that it's never too late, that you can be healthy, okay? Even when you're older age. All right? And just to finish off here, this is the last slide. So this is a medical doctor. His name is Dr. David Sabgir. And he was very distressed because he noticed that his patients weren't getting better and he was having a hard time effecting change. So what he did was, and he's a cardiologist. So he said, I'm going to start in a walking group. And he started something called Walk with the Doc. And every few times a month or once a month, he goes out, he takes his patients in the community and goes for a walk. And I share this with you because the concept that exercise is medicine is catching on in the medical community. More and more doctors are realizing that they need to start prescribing exercise. More and more doctors are realizing that one of the best things that they can do for the patients is to tell them to exercise. Right? So doctors are catching on, and the question is, will you? Right? And the reality is that if you want to get a medicine, the medical community has to catch on to that first, right? Because they're the ones that have to prescribe it for you. But with physical activity, you don't need to wait for the medical community to catch on. You and I know how to go and take a walk. You and I know how to go and get a gym membership and to walk on the treadmill. You and I know how to exercise. So we don't need to wait for these doctors to catch on. We can go and do this without the need of a doctor. We can go out and exercise. We can go out and get the gym membership. We can go out and go biking and things like that. So I want to really encourage you to go out and exercise. You're doing a world of good for your body. And it's never too late. Go out and exercise, and you experience tremendous health benefits if you do that. Thank you. So I think we'll have questions. Yeah.
Anyone wants to start for the Q&A? Yes, Roxy, please.
I know someone who has headaches, person exercises, made changes with the diet and everything, but they still eating meat, but they've changed their diet. Why is it the person is having headaches and nausea with it?
Yeah, so headache and nausea, that's true. So there could be a lot of different reasons to get a headache, and unfortunately, we have to sit and like talk for like an hour just to figure out what exactly is going on. But exercise is not a cure-all, right? I mean, because usually lack of exercise is usually not the cause of a headache. Usually there could be like food sensitivities, there could be some blood pressure issues. I mean, there's a lot of different reasons for a headache, and so to really give you a thorough answer, it's going to require more than just what I can really answer here. But someone could be exercising, eating well, right, and they could still be getting headaches. It depends on what is really the cause of that headache. So it's really difficult to really answer that question, at least right now. Yeah. Sorry about that.
I saw a hand for a land. You had? Yeah, okay.
So my question is, if somebody has not exercised for a long time, we're talking about maybe years, what kind of precautions should one take? If there's any recommendation that we make to just be cautious in how they go about the exercise program?
So the question, and I'm going to repeat the question because I think we're recording. So the question was, if someone's starting an exercise, if someone has not exercised for a very long time and they want to start exercising, what are some precautions, right? When you go to the gym, they'll usually tell you to fill out something called the PAR-Q form, which is the physical activity readiness questionnaire, and they'll ask you a few things, and basically, my thing is this: you have to look at whether you have a medical condition, especially regarding like the heart. Okay, if you have a medical condition, then you need to go to your doctor and get clearance. Okay, so when I did exercise consulting, I had patients come and they say, I had like this and this disease. Then I was telling them, especially heart disease, then I'll tell them you need to go and get clearance for your physician. So if someone comes to me and they say, I've been exercising for a long time, then we have to look at, okay, do you have any medical conditions, right? If you don't have any medical conditions, but you just haven't been exercising, then the good way to start is just by low intensity physical activity a few times a week, right? But if you don't have any medical conditions, there's really no known kind of like really serious precautions that I can really think of, except for a medical condition, right? But obviously, if you're deconditioned, this is the word that we will use, right? If you haven't been exercising for a long time, then yeah, don't go and like run a marathon, right? Just start with walking, and start with like 20 minutes per day, things like that, right? Don't try to like overexert yourself. So this is what I'll be saying. But the real thing that you have to be really concerned about when you start to exercise, when you haven't, is really, do I have a medical condition? And if you do, then you should go talk to your doctor first. That's the thing, yeah. Especially when it comes to heart conditions. So.
Okay, my question is, if you have a family history of diabetes, like if you have both parents are diabetics, what step can the rest of the family take to prevent this from happening? Because we know that it can be reversed, but what steps can we take?
So the question is about reversing diabetes if there's family history. So there is, genetics does play a role in every single disease. But however, we know that, and is this type 2 diabetes?
I think so, yes.
If it's type, yeah.
Because, I said it because my dad, he lost his sight to diabetes.
Right.
So it couldn't be type 1, so it had to be more,
Did it start at an early age or at a later age?
Later.
Late. Okay, so that's type 2.
Yeah.
Okay, we know that type 2 diabetes is caused by lifestyle, right? So even though there might be genetic predispositions through passing on of genes, but we know that. So we say that genetics loads the gun, but lifestyle is when you pull the trigger. Okay, so even though you might have certain genetic things in your family, it's the poor lifestyle that really brings it on, right? So in terms of preventing diabetes, there are some few basic things that needs to happen. First, eat a plant-based diet, and I would say I believe the science shows that a plant-based whole foods vegan diet is best for preventing diabetes. Exercising, as well as very important, prevent excess weight. Because when you have excess weight, and when you get to the diabetes talk in a few months later, I'll talk about this. A lot of people think that sugar is the cause of diabetes. Okay, this is not the case. Okay, sugar contributes, yes, but it's excess fat buildup in your internal organs that's causing diabetes. Because when you have fat buildup within your internal organs, that causes inflammation in your organs, which then causes things like the pancreas to get out of whack. Okay, so you want to prevent excess fat buildup in your body. Okay, so maintaining a low weight is one of the biggest things that you can do for yourself to prevent getting diabetes. Okay, so a whole foods, low plant-based vegan diet with exercise, healthy lifestyle behaviors, as well as ensuring that you are within a healthy weight range. That is one of the best things that you can do to prevent type 2 diabetes, which is caused by lifestyle.
I'm kind of glad that you have cleared up the fact that sugar is not the #1 contributor to diabetes. Unfortunately, for many of us,
it does contribute, but it's not like the only thing. Yeah.
#1 contributor.
Yeah.
Because one of the time when I was kind of reading a lot, I studying, I realized that milk is one of the #1 contributor to diabetes.
Type 1 diabetes, that's true, yes.
Because of the antigens and the antibodies that they have.
Yeah.
So whenever we drink the milk, because milk usually its purpose is to go into the body to basically look for, foreigners to destroy. Unfortunately, when they can't find any of that, they attacks the pancreas, and we know the pancreas is responsible for the distribution of insulin. So, sometimes when I tell people like, milk, because most of us like to drink our tea with milk, or cereals with milk, but I'm glad that you clear up the fact that sugar is not, because most of us, we grew up thinking that sugar is the main, contributor to diabetes. So, yeah.
Yeah, I've read studies where they show that milk is a contributor to type 1 diabetes, because type 1 diabetes is an autoimmune condition where your body's attacking the pancreas, right? And we know that milk promotes that type of allergic autoimmune kind of pathology. So I agree with you there. And yeah, going back to the sugar becomes a problem because of the diabetes. Okay, sugar becomes a problem because of diabetes, but also excess sugar does contribute because it helps put on pounds and things like that. But it is not like the only cause, right? We have reason to believe that fat, intra-organ fat, is one of the leading causes, one of the leading pathological factors in diabetes. I'll show you that in our lecture on diabetes.
One question I have is there such a thing as over-exercising?
There is. There's something called, so in the exercise science, there's something called overtraining, right? And so, in fact, I want to bring that study today, but they actually said that if you go beyond the physical activity guidelines, so they say, okay, you got the physical activity guidelines, which says 150 minutes per week, right? They say, okay, if someone goes beyond that, maybe they do like 2-hour runs like every day. There's these people that are training for like endurance runs and stuff like that. Like if they run for like 2 hours a day and things like that, does that give them extra health benefits? And what they found is that it actually does not. Okay, so the 150 minutes per week of aerobic exercise is kind of like, it's like really what you need, right? If you do a little bit more, that's good too. But once you start getting to like, I'm gonna train for ultra marathon, I'm gonna do the Tough Mudder, I'm gonna go do like triathlon, and then you're like training tons. You're actually not doing really any added health benefit to yourself by doing that. Okay, I mean you become really fit, but doesn't necessarily mean that you become healthier, right? They found that too much exercise is not that great. So, but the way that you could tell if you're over-exercising, if you after you exercise, you shouldn't be like the next day, you shouldn't be like completely drained and things like that, right? You should be able to still function. So we're not athletes. None of us here are athletes. We're just normal people. So just doing 30 minutes of aerobic exercise with maybe another 30 minutes of strength training, really that kind of stuff is really kind of what you need to stick to. You don't need to think, oh, I'm going to become an athlete now, and I'm going to like run in the morning and then do strength training in the afternoon and do another run in the evening. You don't need to do that kind of stuff. So that's not that really important, at least when it comes to health. Yes.
Hi. So it's like 1 hour every 3 times a week would do it? Like 30 minutes of cardio and then muscle training. So it's 1 hour in all, correct?
It's 150 minutes for the week of aerobic. So I don't know how all the math comes out if you do like certain days.
Oh, so you divide that 150 minutes by 7.
6 or 7, yes, whatever, yeah.
Okay, okay.
So, but that's aerobic.
Aerobic.
If you're doing strength training, that's on top of that.
On top, okay.
On top. So yeah, so 150 minutes of aerobic physical activity. If you do strength training, that's on top of the 150 minutes.
Oh.
So it comes out to around 20 minutes per day. If you're doing like 6 days, it might be like 30 minutes. If you're doing like 4 or 5 days, that might be like 40 minutes of aerobic per session. So, yeah.
Another question is, what if people who have joint pains and arthritis and things like that, and they have difficulty to move, like how can they what's your view on exercising?
So it's very interesting. If you go on the Arthritis Foundation website, they'll say that even if people who have arthritis, and even, in fact, they'll admit that it seems counterintuitive, but people who have arthritis actually should be exercising. Okay, and in fact, exercise is one of the main prescriptions for people with arthritis. Okay, now obviously it's all individualized, right? So we have to look at each case. that comes with someone who has arthritis. You have to look at each individual and see and try to tailor the exercise to that person. So if like the pounding, right, kind of is really painful, then you might think like cycling, where like there's like less pounding, right? Swimming and things like that. But the point is, when you're actually using your joints, you actually bring like nutrients and blood flow to the joints, which is actually very beneficial to your joints. Okay, so and we also know that with arthritis, there's inflammation happening, and we just talked about how exercise is anti-inflammatory. So there's various reasons to exercise, and for those who have arthritis, exercise is actually prescribed for people with arthritis. Yeah, but exactly what it looks like is all individual, obviously. Yeah.
Is there any more questions for Dr. Cho? Okay, so if there's nothing else, let's give a round of applause for Dr. Cho. Thank you so much for doing this for us.